are essential. I think we're all trying to figure out how to actually operationalize AI and in ways that are improving access and outcomes. But as has been talked about a lot, we want to make sure we're not reinforcing existing inequalities. And so what we want to do on this panel is build on that. And I'm going to jump right in. We're going to zoom in on one very practical question that shows up in, I think, almost every deployment of AI, at least in our experience thus far. And that is, where should the artificial intelligence live? And that we could be talking about hardware, software, but what needs to run close to the user? So for example, on your device, versus what should happen centrally. That could be in the cloud, or it can mean a number of things across the continuum of AI. And we also want to know, how do real world constraints shape that decision? So you're out in a field, you're in a rural clinic, you're going to have a different solution than if you're working in a different setting. And that decision about where you put the intelligence has real implications. It affects, and these are things we're going to be talking about today, but whether a solution is going to be reliable, usable, and trusted over time. As I just said, especially in places where conditions aren't optimal, connectivity is not consistent. I think we've all had a lot of experience with that. Costs matter, and people need to be able to operate and maintain these systems day to day. So we're going to focus on 3 things with our panelists. We're hoping this will be a really concrete discussion, hopefully some takeaways for the audience. But we're going to talk about where the intelligence layer lives and why, what's making these systems work in the real world, and what it takes for this impact to scale and endure. And we're going to explore all of this through the examples of our 3 incredible founders, panelists here, who are building and deploying their own AI-enabled solutions right here in Kenya. And then we're also going to bring in my wonderful colleague to bring an industry perspective and help kind of connect the patterns that we're seeing across organizations. So I know the room we'll see if it fills up a little bit more, but maybe just a quick show of hands so we know who we're speaking to. But who's in the room? Do we have technologists, sort of the IT designers and implementers? Okay, cool. That's what we were expecting a little bit and hoping for. Implementers? Okay, few. But researchers? Okay, great. Policy people, maybe. And then I guess the rest of you, others. But thank you again for joining. So I'm going to introduce our panelists, and they're the people you actually came here to listen to. So bear with me while I go through their introductions, and then we'll jump right into the meat of the conversation. So first here, we have Joyce Rugano. She is the founder and CEO of EcoRich Solutions. So I'm going to toot her own horn. Joyce is an award-winning climate tech entrepreneur focused on circular economy solutions and sustainable agriculture. Through her leadership, EcoRich has built a model that addresses environmental challenges while also creating economic opportunity. They're engaging hundreds of young people across the waste and agriculture value chain and improving agricultural conditions. She's very passionate about and very accomplished in sustainable agriculture and women and youth empowerment. And her vision is to restore degraded soils, strengthen food security, and scale impactful solutions across Kenya, Africa, and beyond. I should say her co-founder is here too in the audience, Robinson. And then we also have next, Dr. Alice Muhuhu. She's the founder and CEO of Aurora Health Systems. So Alice is a doctor in training, and she's leading a medical technology company focused on cardiology and maternal health. Aurora Health takes a distinctive approach by combining diagnostics with clinical support systems to deliver homegrown solutions that can be scaled across low-resource settings. Aurora's work is already demonstrating measurable impact and has received multiple awards for improving access to diagnostic care. She also brings a really strong research background in digital health and remote monitoring. Hopefully we're going to hear a little bit about the research side of what she does too, and is focused on making advanced diagnostics more accessible and scalable. And her co-founder, George, is here in the audience as well. And then we have Esther Kimani, founder and CEO of Farmer Lifeline Technologies. Esther leads a climate tech company focused on strengthening food security and climate resilience through the use of advanced technologies. Her work centers on making these tools practical and accessible for smallholder farmers with a focus on improving livelihoods and agricultural outcomes. Esther has received global recognition for this work and is on a mission to impact 1 million marginalized smallholder farmers by 2030. And there's a little picture of each of their solutions up there next to their photos as well. You're going to hear a lot about them, obviously, in a moment. And then last but not least, joining us is for our industry perspective, we have Elizabeth Migwala, Vice President of International Government Affairs at Qualcomm, and my favorite colleague. And I would say that even if we weren't the only two people here. But Elizabeth leads Qualcomm's government affairs work across Africa and the Middle East. She works closely with ministries, regulatory authorities, and international bodies to drive the adoption of advanced broadband wireless technologies and services. She is a strong advocate for innovation and has been at the forefront of Qualcomm's Make in Africa platform, which you'll get to hear about a little bit today. And it aims to support startups based in Africa, building solutions that address real-world challenges through applying advanced connectivity and processing technologies to end-to-end system solutions. So you would not know this by looking at her, but with over 30 years of experience across engineering, strategy, policy, and relationship building, she brings a really unique perspective on how technology, policy, and ecosystems come together to enable real-world impact. And we're very lucky to have all of them here today. So I will stop talking and we're going to dive in. So really quickly, you're all startups, so you're very experienced in sort of the pitch setup, but in 1 minute, we'll just go down the line here. But can you tell everyone what's your solution and who is it serving?
Thank you, Erika. Can you hear me? So my name is Joyce Rugano. I am the founder at EcoReach Solutions. So EcoReach is a climate tech company that is building waste recycling technology called WasteBot. So WasteBot is a smart recycling machine that is able to recycle any type of organic waste to nutrient-rich organic fertilizer within 24 hours. So it's mobile and automated. It uses IoT sensors, artificial intelligence, thermophilic processes, and the Qualcomm EC25 connectivity. So we primarily recycle waste in urban areas like Nairobi, majorly the food markets, and then the output, which is the organic fertilizer, we sell it to small-scale farmers in the rural areas at a very affordable prices. So what excites me today is the fact that we are building an African AI tech that is able to solve environmental and agricultural issues. Thank you.
Good morning, everyone. My name is Dr. Alice Muhuhu. I'm the founder of Aurora Health Systems. And what we do is we locally develop wireless heart monitors, electrocardiogram devices. The device is known as Moyo ECG. We have paired this technology with an artificial intelligence diagnostic support software. We primarily target peri-urban and rural facilities. So our main mission as a company is to decentralize specialized cardiac and maternal services. Thank you.
Good morning, everyone. I'm Esther Kimani. I'm the founder of Farmer Lifeline Technologies. At Farmer Lifeline, we develop AI technology to help smallholder farmers detect pests and diseases on time. It's made here in Kenya, but the scope is global. We are looking at 1 million smallholder farmers by 2030. And why this matters is because we are losing 43% of the food being produced globally to pests and diseases. And this is costing us $220 billion every year. And this is food that is enough to feed 1.2 billion people. So that's why we're doing what we do. And I'm glad you're all here to also share in the work that we're doing.
Thank you very much, everybody. So we're gonna take a step back into the past. So you've told us what you're building, and because we're talking about your design decisions, where you're placing the AI, want to go back and think about when you made those decisions. So what problems and constraints shaped your approach, and how did that influence where you decided you were going to put this intelligence layer where it needed to live? Is it more on the device, the cloud, or a hybrid mix? And because we're doing great on time, I think the audience would probably also like to know a little bit about your why, why you're solving this problem as well. So Alice, why don't we start with you since you have the mic?
Yeah, thank you, Erica. I need to start with the why. So actually, cardiovascular disease is the leading cause of death in the world. Out of every 3 deaths, one of them is attributed to cardiovascular disease. And as I mentioned yesterday during our tech demo, it's always been a problem as Africans. We've always thought was going to be in the future, but not anymore. It's very much here. Cardiovascular disease, according to WHO, will surpass infectious diseases, which is TB and AIDS and malaria. It will surpass it in the next 3 years. So by 2030, it will be the leading cause of death in sub-Saharan Africa. So just on an overall perspective, that's our main why. I would say that's like our North Star is this problem statement. And I want to go back to the question you asked about the design, our earlier choices in design. So for me, I don't think it was much of a challenge because I'm so close to the problem. I work in the largest public facility in Eastern Central Africa. I think we see over 10,000 patients a day. So I had a lot of reality already embedded in like our solution when we were starting, because I knew the main challenges just from the solutions that because I'm a doctor myself working there, and I know the kind of solutions that are brought to our doorstep and how difficult integrating them into my workflow as a doctor is, and as well as like the nurses and the clinical officers who work with us. So Kenya is tried very hard to decentralize healthcare. I think they're doing quite a good job, but in as much as this is happening, all these initiatives, healthcare is still very much centralized. And of course, we know most of the cardiologists are based in Nairobi. But what people don't actually talk about enough is the utilities are also concentrated in the city hospitals, and that leads to the decentralization. So I'm talking about electricity, I'm talking about internet. And so you find the referral system, you'll come to a primary healthcare clinic in the rural areas, and they will just refer you up to a facility. They'll be like, go do that MRI in a place that is having stable connection, having a radiologist on site. So that's kind of what we did. So the trade-off that we made in terms of our design was trading complexity for resilience. And so our intelligence lives on the device. So our device can be used offline, and it can be used so that means it can be used without electricity. And also we don't rely on cloud. We do have we practice hybrid AI, the model. So when cloud is available, you can send the report, and then the report can go to the cardiologists in Nairobi. And when cloud is not, like the internet, the cloud servers are maybe shaky, AI can be processed on device. So that means the heart signals can be processed live, even when the connection is intermittent. So, like in healthcare, it's like an aeroplane. The signal cannot go off at all. Like a signal going off is a life. That's it. It's a life that's gone. So things must work offline, and definitely we have to rely real solutions that don't rely on electricity and internet. Yeah. Thank you.
Thank you. For us, one of the biggest realities that shaped our design decision is the fact that in the environment we live in, infrastructure cannot be assumed. In Kenya, things like internet connectivity, electricity, lack of not having efficient technical support is a great challenge to us. So what we did when we started EcoReach Solutions, when we designed our first waste bot, it was actually taking 10 days to do the conversion. That is, to convert waste to fertilizer. It was taking 10 days. And what we realized at that point is that it was very manual and we were not solving the problem we actually wanted to solve. Because you can imagine how much waste. In Nairobi alone, the city we are in right now, every day we produce about 3,000 tons of organic waste every single day. And I can tell you only 90%, only 10% is recycled. 90% goes to landfills. So we had to do it fast. So when we developed our first waste bot, it was taking 10 days, and then it could not control the waste that we recycle. I can give you an example. In your house, when you're putting in the waste in your bin, I believe you put everything together, the food waste, the plastic, everything together. Where do you think that waste goes? Who sorts it out? So that was a big challenge to us. So we get the waste, but remember, we're only using the organic waste. So what do we do with the rest? Do we sort one by one? Yeah, that would take years for us to solve the problem. And again, how do we move the time from 10 days to fewer hours? And so at that point, we realized we have to do something. And that's when we decided that we have to build an intelligence in the machine that would fasten the whole process. So we decided to build the intelligence in the machine. And what it does, we reduced the time from 10 days to 24 hours. Today, we are recycling that waste in 24 hours. And more to it, when you put like the waste in the waste bot, what it does, we are able to sort the waste. It's able to sort the waste. So if, for example, this pen went into the waste bot, it's able to detect it and just put it in a different chamber. And that has saved us a big time. It's sensor-based, it's sensor-based and real-time monitoring. It also, we are able like to measure the real amount of the content, nutrient content in the output. For example, if farmers have farmed different things, and every farmer have different condition of their soils. But so that means we can't give the same farmers the same things, assuming that they will achieve the same results. So we had to monitor our output, which is the fertilizer. If you plant maize, then we have to tailor-make our fertilizer to meet your needs. If you farm vegetables, we have to tailor-make. So all that came in when we introduced the intelligence in the machine. And so our machine, despite, even if there is no connectivity, even if there is no power, we are fully solar powered, the machine can still operate even in those conditions.
I think I'll also start with the why we're doing what we do. For me, I'm born and raised in a farming community. Mom and dad are farmers, and I'm a firstborn daughter. So I got to understand what it meant to be a smallholder farmer and to rely on a farm for every need. And so when I saw the devastating effects of pests and diseases, of course, as a firstborn, you get to know a lot of things in the family, and realizing it was not just a problem in my family, but also in my community, and also realizing that even in Africa, we have over 30 million smallholder farmers facing the same challenge of pests and diseases. And so again, I was the only girl from my village who made it to the university. And for me, it was a point of responsibility. Why not do something to impact my community? And so I had the opportunity to study computer science. And so computer science presented machine learning, data analytics, AI, which also came a bit later. And I saw an opportunity with what I had studied, relating it to the kind of background that I had growing up. And I saw an opportunity to use that knowledge to go back to my community and present a solution to a pressing societal problem. And I think that's what most of us here are saying, that we've lived through what we are solving, and we've seen it almost every day of our lives, really. And what informed the design of the solar-powered cameras is, one, the communities that we are targeting, some of them are off-grid, without the electricity or even internet penetration. And so we had to think of a technology that would serve such a community. And that's why the solar panels came into place, that device can be used anywhere around the world where there's no electricity. Then two, we linked it to GSM technology. GSM is what enables us to receive the SMSs on the phone. And practically, even a farmer in these rural communities is able to read a simple SMS on their mobile phone. So we had to leverage what already exists, what they know. And so the SMS was the easiest mode of communication to them. So we thought solar-powered camera, communicate through SMS, and then not only in English, but now translate the message to a local language that they can understand. So that informed what we have today as a solar-powered AI device, able to send SMSs in local language. And we also had to think about cost, because before you invent something or when you're solving something, you ask yourself, who else is in this playfield? Who else is trying to solve this problem? And there were private agronomists. So private agronomists take samples of crops to labs and then come back 2 to 3 weeks later with a diagnosis. So if it is an invasive pest, the destruction will have already been done within the 2 to 3 weeks. Drone companies are doing a good job, but not serving the smallholder farmer. They're charging $100 per hour. $100 could be what a smallholder farmer is earning in an entire farming season. Again, that is not affordable. So we thought, what is this technology that can be on the farm 24/7, but also affordable to the smallholder farmer? And that's why we charge a subscription fee of $3 per month only, no installation cost. So yeah, that informed our design.
Thank you very much. And I have a lot I want to say, but in the interest of time, I am going to, Elizabeth, put you on the spot. So you're an engineer yourself, and you're spending a lot of time in the spaces that you're in, thinking and hearing about AI's potential and its potential pitfalls. So just based on what you've been hearing, is there any perspective that you'd like to add?
Yes, thanks very much. And like Erica says, I'm an engineer, and actually one might be wondering what I'm doing on this podium, because I work for a company, Qualcomm, which is at the forefront of, technology, mobile revolution, redefining connected processing, enabling intelligent computing everywhere. And you'd be like, I really am out of place. Can you hear me? It seems a little out of place. But I think the dot that I want to connect here is watching where technology development is going, watching the speed at which things are changing, watching the big companies, AI companies, ourselves included, innovating at a breakneck speed. The question that I have been asking, the question that we were asking is, how appropriate is that technology to local challenges on the ground? And I think the dot that we are connecting today is that, yes, when you partner that technology that is developing at that breakneck speed, remember the technology we're innovating in Qualcomm is used in developed countries and developing countries, and should be used in even the least developed countries. How do you harness that technology? Our hypothesis, my hypothesis, is when you connect that technology with innovators in Africa who understand the unique challenges, they are best placed to harness that technology and adapt it to the challenges they have. And I think the three you have heard today is a demonstration. Whoever thought that AI technology, connectivity would play a role in waste management? Whoever thought that our own Kenyan-born doctor could innovate technology that enables a cardiologist to help people in the rural areas? Whoever thought that small-scale farmers would benefit from AI to understand the pests that are disturbing them on the farm? So I think that's the link that I would bring in. Technologists have a place. It is an ecosystem of technologists, innovators, and of course, the communities that we serve. So that would be my comment.
Thank you so much. So we're going to move on to kind of the present now. So you told us about the decisions you made at the beginning, but I think we're all interested in how to operationalize AI, which I said at the beginning of this panel. And so we want to know what happens when your solutions left the lab or the pilot phase and they meet reality, the rubber hits the road. So what are you finding that has mattered most to make your solution, what we said at the beginning, trusted, adopted, and reliable? And then based on that, what are the impacts that you're seeing as a result of the use of your solutions? And so, Esther, we'll start with you, and then we'll just come down this way.
Okay. When we hit the ground with our technology, we were very, of course, optimistic. As an innovator and an entrepreneur, you think you got it right, and you go and meet a farmer in the rural area, and that is when you get feedback to look back in to what you're doing so that it can actually solve the problem. I'll give a good example. With a first prototype, the message that was sent to the farmer was in botanical names, you know. Even I couldn't comprehend the message that was being sent. And we had to take it back and have it in plain English. And we felt, you know, as plain English, we've done our work. And we went down to the ground with our English, polished British English, Oxford Dictionary English. So, but what we found on the ground is that you're meeting an old farmer who will not understand the English that you're presenting to them. And we had to loop back that feedback to translate the message to local language. Now, in Kenya, we have more than 42 tribes. And so that is a lot of work. And we had to go back again and start looping in. But that's where the natural language processors, that's machine learning, and also the AI comes in. And you're able to translate these English messages to local languages and make the information available again to the farmer. And now they're able to action whatever you're telling them. And it taught me something. AI, for it to be impactful to these smallholder farmers, you have to break it down. They don't have to know about the machine learning. They don't have to know about the tech part of it, but let them see the impact of that technology. So when they began seeing the tangible impact of the technology, increasing my yields, the losses are not as much as I had previously, that it was easier now to get a buy-in to the community. Our product is experiential. By that, I mean, you need to use the device, see the impact of it, so that you're also willing to pay for it. And I'm talking about people who are not used to using technology in their farming. They're using traditional knowledge for them to detect the pests and diseases. Then you come in with a technology that you need them to pay for, and so it must have tangible impact. So for us, for the technology to be trusted, it has had tangible impact in the lives of these smallholder farmers and given us the confidence to even scale beyond the Kenyan borders.
I know that we don't have a lot of time, but maybe you can say quickly a data point or two about that impact.
Oh, sure. So we have the devices in about 5,000 farms here in Kenya. And when I'm talking about impact, I'm talking about more than 47% increase in yields and reduction in losses by over 40%. This may look like just numbers, but when a smallholder farmer gets 1,000, more than 1,000, 10,000 shillings extra, 20,000 shillings extra, it means that there's a child who's going to go to school. They don't have to drop out of school. In some communities, it means that there are girls who will not have to be married off early for the parents to have some money. Some boys will not have to drop out of school to help with herding and the like. Children are staying in school and basic needs are being met. And on top of that, the dignity of smallholder farming communities is being restored, because sadly, they are feeding 80% of the world's population, but they are still lying under the poverty line. When we're talking about those who are below the poverty line, we count the smallholder farmers down there. Yeah.
Thank you. Alice.
Yeah, so I think your question was on trust and adoption and reliability. Yeah, so what's unique about what we do as well is because I'm also a customer to people. I am a doctor, so in as much as I'm an innovator, people do come from different countries to sell us their solution or pilot it through doctors in the facilities. And I'll tell you that different EMR, which is electronic medical record systems, have been brought from foreign countries and they have brought to us to pilot this. And I can see how little they consider like training us and integrating it into a workflow. And I can tell you that as soon as you just make a doctor or a nurse's life just a little bit difficult, they're not going to adopt that. So that's about adoption. So when we were on the field, like with our technology, as I mentioned, we are mostly in rural facilities. These three specific questions that we wanted, that they pushed back on. So number one, people care a lot less about novelty than you think. People care a lot more about reliability. So the first question, because remember, there's no cardiologist in the rural areas, so it's a nurse, and she wants to know, okay, you've brought your solution. Are you making my life easier? Are you reducing my work? Like, okay, it's great, it's fancy, it's glamorous, it's IoT, AI, but are you making my work easier? The second question is this reliable? Because a lot of doctors are mobile. So you'll find in Kenya, we have like a lot of locums. So a doctor will work in one facility that does have a computer, does have good connection, good internet, and then they move in the evening to go work in a facility that doesn't even have a computer or the connection. So they want to know, is this reliable, that when I move, it's going to work for me? And the third question, they wanted to push back on us that, is this upskilling me? And is it making me confident to serve my patients? So far we're in 100 clinics in Kenya, and we have answered this question. I'll start with the first one about, is it making my work less? ACG is interesting in that it's printed on a graph paper, and it takes, you have to monitor people in cardiology continuously. So we have a lot of time series data that needs to be interpreted. So AI has cut down the time from, on average, 30 minutes of interpretation down to less than 5 seconds. So it's able to annotate the exact anomaly. So it does anomaly detection. That's the AI models that we use. The second thing about, I mentioned about doctors being locum, we made our device to be portable. So it can work in a facility, maybe like I said, with stable connection. And then if they move to another city, it can still work even if there is no connection, because like I said, we're processing on-device AI. And the third thing, we offer diagnostic support. So AI is not here to replace cardiologists, not here to replace doctors, although they're saying that it is. But we offer diagnostic recommendations. So if a clinician or a nurse is using it, they're able to get a report that makes them more confident to, then the report is sent to a cardiologist, they do the oversight and then send it back. Yeah, so those are the three questions we've been able to answer for our customers.
And before we go to Joyce, maybe just quickly, because there's been a lot of conversation too about localized data sovereignty, a lot of that. And I think you're doing some really interesting work there with Aurora, and maybe you can speak to that quickly as well.
Yeah, thank you for bringing that up. So despite us being almost a quarter of the world's population by 2050, we only contribute less than 1% of data into the AI models, right? So this is hugely concerning because there is a lot of AI bias that is being seen. Of course, this is ongoing, but we've already seen this like in radiology, where it's very well documented about the AI bias between Caucasian data sets for detection of mammogram in breast cancer, and as well as in African patients. So that is documented in ECG. It's ongoing research. research which we are participating in. We actually have some work ongoing with the University of Oxford, which they're using European data sets and comparing with African data sets to check that if there's bias. So our work on top of devices, we are contributing to localized data sets. So we are one of the first companies to train our models using local data sets, and we are contributing to the global research of making sure that there's proper representation of African patients. Thank you.
Thank you. And just before we move on to Joyce, we started a few minutes late. I know there's lunch soon, but we do have a little bit more, and then we'll keep some time for Q&A. So if you're able to stay with us, even if you missed the first 5 minutes of lunch, we would so appreciate that. And so over to you, Joyce.
So one of the biggest lessons we've learned is that technology alone is not enough. We have a great technology, we've integrated AI, we've integrated a lot, but that alone is not enough. In real deployment, trust, reliability, and real results is what matters for us. And what this actually means is in urban areas, we want to see clean environment, we want to see reduced waste, we want to see affordable fertilizer, we want to see more farmers served, we want to see increase in yields, food production to be no longer an issue. And for us, that's what matters. And what I can tell you is, since we introduced our technology, we've seen a lot of this in place. And I can tell you, we really need to do is to embrace technology, because with more than like 4,000 tons recycled every month, we've been able to serve over 10,000 farmers. And what 10,000 farmers looks like a small number, but let me tell you, when you go to the rural areas and you see how many farmers with very big piece of land, but they don't have anything to do with it because of their poor soils, then you'll understand what that means. So we've been able to serve over 10,000 farmers, being able to recycle that amount of waste every single month, and being able to actually employ people. Every month we work with over 400 women and youth. That is in waste collection, in the recycling, in the packaging, out of the many every month. So for us, it means real results. As much as we have a good tech, as much as we have to use it, then we have to see real results on the ground. That is on the urban areas we are serving. That is for the farmers we are serving. Then that would mean our technology is appropriate.
Thank you so much. And we'll just do one more question and then Q&A. So sort of a parting shot. But we've talked about design and what it takes to make these systems and these solutions work out in the field. But looking ahead, and based on what you've learned so far, what needs to be in place for this kind of impact to scale, to endure? We've talked about that a lot this last day and a half. So this could be within your own organization, or maybe it's a more macro level, partners, systems, or policy. Just in 1 minute each or less, can you weigh in there? And we'll just go down the line again this way.
Thank you. For me, or for us, we think, first of all, it's acceptance and the mindset change for all of us, not only the innovators or just all of us. I'm telling you, there are many times I've worked in organizations or in the government office. I need a certification. But just because someone doesn't believe that something can be recycled in 24 hours, they'll not give you the certificate. And I feel like for us to scale, we need people to change their mind. We need people to know that technology is here, AI is here, and we have to adapt it. I also think that the policies, I'm glad Elizabeth is here, the policies that are put in place, they should support innovators like us who have real technologies that are solving real problems on the ground. I also think like financing. You know, if I tell you how much money we used for us to get to where we are in terms of developing the tech, it's very expensive. And for us to scale it to where we want to be, it's very expensive. And what you would need, it's the financial support. It's real. Yeah, it's real. It has to be there for us to scale technologies. And finally, I would say partnerships. So we cannot go far without partnerships. For example, for us, if it was not for the Qualcomm, them introducing their tech to our wasteboard systems, we wouldn't have achieved what we have achieved so far. Having piloted one of our wasteboards with with their kit means has done a great difference in what we've been doing. And that makes it easy for us to even scale to where we want to be.
Yeah, I think for us, I'll just start with the initial 12 to 18 months of our company. It's not easy when you're doing certain novel innovations to get early funding. And I think what kind of carried us is the fact that in as much as we're solving an African problem and a Kenyan problem, we are solving a problem that the world cares about. One of my favorite quotes that I like to say is that, do something that you care about, but the world cares about more. And we found that that really carried us at the beginning stages, where we got a lot of in-kind support, where in as much as we're developing something, we'd have somebody, you reach out to somebody in Korea and they're like, okay, I can connect you with a cardiologist who can move you a little bit further. So that really, really helped us to endure the difficult times at the beginning of the company. And for the future, I think definitely partnerships are incredibly important. International companies that are coming in and finding a way to work with local entrepreneurs like Qualcomm that are doing such a fantastic job on the continent, and bridging that gap, especially like for technical deficits, and just really finding a way to collaborate with us. I would also bring up the fact about policymakers. I do find that in healthcare specifically, the policymakers are always in different rooms from tech and also in different rooms from the doctors. So I think that I would really like to see these rooms coming together a lot more. Yeah, thank you.
Thank you for the question, Erica. When I'm looking ahead, I'd like to encourage all of us in the room to be open to investments that are going to AI. As one of us has also said about the data sets that are being biased, there are more and more startups and companies that are also working around AI and also need that investment in their R&D. For example, at Pharma Lifeline, we're also heavy on R&D. And these startups need time to go back on the ground and loop in the feedback that they are getting from the clients. And in this case, when you talk about clients, these are people's lives that we are dealing with. And so that patient capital towards investment in AI. Then two, when it comes to hand-holding of startups and businesses, let it be tangible. A good example, of course, I'll give it about Qualcomm, is that they have taught us the importance of intellectual property. And through the Qualcomm Make in Africa program, we were introduced to some of the best attorneys when it comes to patenting. That's Adams and Adams. And they've walked us through a journey of patenting the innovation. So when we're talking about also support to businesses and startups, let's also think about how to protect intellectual property, which we've seen it very tangible actually through this program. They've also supported with the hardware kits that we're using for our technology. You see, when we go beyond also financing, I'm talking about the tech. So previously, how our tech was working would require a lot of time for diagnosis. But with the introduction of this tech, we are now able to do on-device detection of pests and diseases and diagnosis, making it faster and making the device serve even more people per device and lower our costs as business. So let support to startups and businesses also feel tangible. Let it be tangible, not just a class where they sit down and they learn how to run their businesses, but something that they can actually point to that has improved their business operations. Then last but not least is partnerships again. I'm working with farmers. So anyone in the room who knows how we can get to the 1 million smallholder farmers by 2030 today, why don't we reach the 1 million farmers today instead of waiting for 2030? And any ask that a startup has to move them forward and you're in a capacity to do it, there's no need of postponing or having another conference for us to discuss how the startups can actually be assisted. So looking ahead, I wish people are more intentional with whatever choices that they are making and whatever they're feeling in their hearts to support, let it be intentional and not conversational. Yeah.
Thank you so much. Elizabeth, I think the panelists answered my question for you already, but So how do initiatives like Qualcomm's startup mentorship programs and our developer ecosystems, how are they helping move innovators from early deployment to sustained impact? And I know we're talking about business, but these aren't just for businesses. Anybody who wants to learn can do that. We'll keep it super tight, and then we have questions.
Yes, honestly, because of time and the fact that there may be questions, I will just reiterate 2 or 3 points. So as a partner, I want to say to you that these are 3 out of over 400 startups that we have worked with as Qualcomm globally in 25 countries. And the one thing that I have been speaking to them about is the world is a global village. So a key part of our mentorship is exposing them and getting them to talk to others in other countries who are doing things that are similar. So that's the first thing. The second thing is learn to protect your innovation. We cannot stress this enough. And so as she told us, there are a lot of, in Africa, we have the youth dividend. There are so many other startups. The issue is have an invention and protect it. The third thing is your business case must close. It's a business. Any business that is solving a problem here in Kenya that has a value will hold its own, not just in Africa, but everywhere else. Okay, but these are not pilots. These are not, these are businesses. And the reason we are working with them is Qualcomm itself is a business based on innovation and partnership and patents. So those are the 3 that I would talk about right now. I could go on and on, but there are 3 out of many. And in Africa, we have a youth dividend. Can we replicate this in all sectors of the economy? I think we will see a difference, not just sectors of the economy in Kenya, but our startups are all over Africa, by the way. So this would be my comment.
Thank you so much. And then I know that we have 2 questions online, and so they asked us to take those first since we'll all be here. So cool.
So
And I'll also say that we have a booth. So if you don't want to cut into your lunch anymore to speak to the panelists, we'll also have a booth that you can find them at too.
So we have the first question that says, most AI models are trained on data that doesn't reflect resource-constrained realities, sparse connectivity, low-end devices, and non-English interfaces. At what point does designing for these settings require training on their data, and who owns that data pipeline? And then the second question goes to Dr. Alice. How do you handle clinical validation and regulatory trust when the AI is making diagnostic suggestions in a context where a second opinion from a specialist may be days or weeks away?
Do you want to address that one first, maybe?
Yeah, maybe I think I didn't touch on this, but our company actually started off as a research company during COVID. I worked with the Kenya Cardiac Society where we were just investigating how the COVID vaccine was affecting cardiovascular disease patients in specific. So we did start off as research, so we do heavily understand the importance of clinical validation, and we have done clinical trials. And we, unfortunately, sometimes when you do clinical trials in one country, it might not be applicable in other country, but we have done them in Kenya. We're hoping to do cross-border trials. Like I mentioned, we have something with the University of Oxford. So it's something we actively pursue. There's new opportunities that have come up where international organizations are even giving research vouchers to startups where you can do cross-border, cross-geographical clinical trials. But we have done that in Kenya. it's definitely it's one of, I think, the first steps of regulation. In Kenya, we do have the regulatory body that's here, and then we have the ISO certification. So we do have that locally, but we are pursuing the ISO 13485, which is the international regulation for medical devices. I think she did, the second part of that question was about specialists and how we can be able, how you can trust that the specialist will give a second opinion if it's days or weeks away. So we do not wait for days or weeks. This is feedback that happens within 5 minutes. So the AI gives recommendation immediately, and then the report is sent, and within 5 minutes it is having human oversight. Like in medicine, we're not allowed to just have AI models giving clinical recommendations. There must be doctors on the back end giving human oversight, like I mentioned. So that's global, right? So our system gives the, and remember I said diagnostic support. We can't just say that we're diagnosing people. We give the recommendation. We say, okay, there's an anomaly. So our device actually has 3 colors. Like if you come to a booth, you'll see this. We have blue for normal. Green is showing that, okay, this is just abnormal. And then red means it's an emergency. So that's what we mean by we give diagnostic recommendations. And then it goes to a cardiologist and says, okay, this could be an atrial fibrillation. And then within 5 minutes, it's sent back, and then they say, okay, this is an emergency, you need to do this, or this, you need further testing or more specialized testing. Yeah, I hope I've answered that.
Did anyone get the first question? It was a little bit hard to hear. I don't know if you could repeat the first question.
The first question was, most AI models are trained on data that doesn't reflect resource-constrained realities, sparse connectivity, low-end devices, non-English interfaces. At what point does designing for these settings require training on their data? And who owns the data pipeline?
Okay, I can take that first. For example, I'll give an example with Pharma Lifeline. The data sets that we have used to train the model are ours. And through the program that we had with Qualcomm, they stressed the need for us to do things using our resources, not any borrowed resources. Do it with your data sets. And they availed an AI machine learning model that we were able to train with our own data. So when the results are coming out, it's not biased. I know that the images that have been used to train that have been collected from the ground. They're not just random images that we've collected from random data sets availed online. These are our own data sets. And we were able to train these models to an accuracy of 97%. That is work that goes in there. There's a lot of work that goes there. Then I also mentioned that with our first prototype, the recommendations that we were sending to farmers were in English. And we had to go back again and look at the translation of that information to local language. And we can now send that information in Kikuyu, in Maasai, and the like, using natural language processors. However, we still stress the need of having human in the loop. Human in the loop. Why I'm saying this is we need to have someone who is accountable for whatever results you're sending to farmers. You know, they have an SMS, but they need to point out who can they ask the question about that result. And so for us, having that human in the loop, we always check what kind of recommendations are going out. And I'm sure it would be the same even in the medical field, that you keep analyzing also the kind of results that people are receiving from your innovation. And that's what it means to also have a human in the loop, because there's the responsible use of AI, and we cannot say we don't have someone to ask a question. So we always have to check the recommendations that are also being sent to farmers.
Who was trained or who are then using or interpreting or receiving the data. I think you talked a lot about how you've intentionally make the data as actionable and understandable as possible, but maybe you could speak to that quickly and then we could take a question or two from the audience.
Yeah. When you've deployed the technology in such a community, there's a training that has to happen because you can't just leave the device there. And so we are very intentional in getting the farmers where they are at. For example, in farmer cooperative groups, in women groups, in farmer groups, and sensitize them on the use of the technology and tell them this is the SMS you're receiving. It will tell you the crop type that you've planted, the pest or disease that has been identified or through the diagnosis, and this is what you should apply and the exact quantities. And this is in their local language. So we are making farmers proactive, not just reactive to an SMS that has been sent to them, but they know what kind of information has been sent there. So we are not ignorant. They also has to have some sense of capacity building, even in these communities. And we take advantage of the meetings that are there in the rural areas, tech demo days, the cooperative meetings. We find the farmers where they're at. And we've also employed youth and even women on the ground who help to disseminate this information to them and answer any queries that farmers actually have. And that's how we are able to loop back feedback from farmers into the technology.
Yeah, question from the audience, or as many as we can, but I also know people want to go. No one says never said I'm good at time management.
Hi. Three excellent presentations. I'm interested, given the connectivity issues you've mentioned, how you're balancing what you do at the device and what you do in the cloud, and in particular, how that's affected the cost of the device, either the cost of operations or the cost of how much technology you have to build into the device and how that affects the cost.
Thank you. If I could just add on that also on the security aspect, because it does seem there's an aspect of IoT where there's like distributed systems, like if it's the case for Aurora, where you have the devices in the field or the waste boards which are like in the field or even in the ones in the farm. How do you deal with the security aspect where you're sending data from one IoT device to maybe a central location and such? Thank you.
To be specific, in the medical field, is one allowed to override the AI recommendation if they hallucinate?
Could you come up again?
Is a doctor or a user allowed to override the recommendations if the AI hallucinates? And still being specific to that, did we test many scenarios in the medical field just to make sure that our model has been refined before we deploy that?
Okay, maybe I can go first on his question. So it's about security and also how we are able to monitor the machines maybe on the ground or something. So for us, what we do, we have our own recycling centers currently where we assemble the waste, where we recycle and then do the distribution. But one of the things that we've done is our machines are sensor-based and we have real-time monitoring of the machines. That is, we have, I can actually control my machines when I'm here. I have it on my phone. And that is a development that has made the process easy and also the security-wise. So as much as the machine is on or off, we're able to control it from wherever you are, real time, showing all the data processed, all the waste processed, all the output processed. And that is because of the several sensor-based technology that we've added on it over time. Yeah.
Okay, I'm going to try to answer your question first about the cost, right? You asked by integrating new technology drives the cost up. So yes, definitely it did drive the cost of putting AI on device. I think up 40% from what we were initially charging our devices. And because of this, we're a very price sensitive market, right? And you cannot like I always say, you cannot innovate around poverty. Like you always have to consider that, can people afford this? So what we did is we just innovated our business model. So yes, it's more expensive, but we have a business model where the clinician can have a revenue sharing model with us. So we can give them the device, like today, they can start off with the device, and then they take a percentage of the test that we're doing, and within like 12 months can own the device. So that's kind of what we did as a company. But integrating AI on device was very important to us. So even if it did drive up the costs, we found another way to offset it. And that's why we're also activating different business models of like we do have like funding support from like research. So it helps to offset for us some of those costs. And of course, we do software as a service, not just the device. So that kind of assists us. And the question on security, definitely, it's a huge concern that's going on right now in healthcare. This is global, about data sovereignty. I know all of you maybe have put your healthcare data on ChatGPT, I don't know, but data sovereignty is a very big issue. So in healthcare, we like to say that we de-identify data. That's as per HIPAA protocols, and that's the international standard. De-identification just means that if I cannot trace back that it's you, John, in Kenya at this time who put that data. So it can't be traced back to you. But healthcare, it's a very sensitive and legal topic. But for us, like I mentioned, we de-identify our data as per international protocol, and that's how we deal with that security. And I think AI on device is also assisting, because remember, the data is staying on the device. So by reducing reliance on like going to cloud, that is a huge benefit of AI on devices. And I know it will be the future technology in the future in medicine. And then the last question, I'll be very brief. I think he asked me, do we have any proof that our local data sets that we're using have been trained? So when we started, we used the international data sets, which is the MIT BIH. That is what we are using, but the local data sets is what we have as a research that's ongoing. Yeah, thank you. Oh, you asked me, can you overrule the doctor if you get a signal? Definitely. I'll give you, it's only allowed in one instance if there's an emergency. You can overrule, yeah, but it's not allowed if only if there's a medical emergency, then you can overrule that. That's what I would say.
Okay, I'll refer back to the first question on cost and integrating AI, what that has meant to us as business. It has actually made the devices more powerful to serve more farmers. And hence one device, if it was serving 3 farmers, is now able to serve between 5 to 7 farmers. And so still the cost that you had to incur to bring in the AI is also helping you on the other side of business to serve more people per device and still keep your costs low as a business. Number 2, previously before integrating the AI, our cameras had to send the images to cloud and then do the processing and then be able to do the diagnosis and send the SMSs. But now with the integration of the AI and the processor from Qualcomm, the devices are doing on-device processing. What on-device processing means, the device on the farm just captures the image, does the diagnosis, and is able to send the SMS through the GSM. So that rules out cloud storage costs for us as a business. So on the other end, yes, it did cost me something to integrate the AI, but as a business, it's bringing in more clients and also now putting away the cloud storage cost for me as a business. And in terms of security, we had to think about that and think about it again. And we have GPS integrated in all of our devices, and we're able to trace all our devices in real time from a dashboard where we see all our devices, whether they've been paid for, and in case any of them is tampered with, the signals on the dashboard change immediately, and you're able to send any of your ground soldiers or the youth on the ground. There's a device that's misbehaving, it's good to go there and check what's happening on that device. Then also, we've configured the cameras in a way that even if you take that camera into a building or to look at cars, it will not function at all. So it will be useless. We actually had one that was actually plucked out of a farm, but we later found it somewhere nearby because I think they tried to use it for another function, but it couldn't because it's only been configured to see plants, pests, and diseases. Thank you.
Thank you so much. I know we've lost a few bodies and I'm sure everybody's hungry, but we really appreciate you joining us. These are incredible innovators, incredible organizations. We encourage you to come and find them and learn more. And we really appreciate your time. Thank you so much for joining us.